The Highland Rim Terrace apartment complex is a HUD development with an age and income requirement. The building is currently shut down. We will have more on the situation there coming up tonight on News Channel 5 at 10. Now to the breaking news. Another round of evacuations are expected at a Gallatin nursing home after a COVID-19 outbreak at the facility. 17 more patients at the Gallatin Center for Rehabilitation and Healing were hospitalized overnight. News Channel 5's Chris Davis just spoke to the nursing home's administrator. And Chris, what is she saying about the situation?
She's saying that her crew has been working nonstop since this outbreak began and that they have everything under control, but this comes as they are starting to load up more patients to head to the hospital that have confirmed positive for COVID-19. They have already loaded up 5 ambulances full of patients from this nursing home facility in ambulances that will head to Sumner Regional Medical Center. They are now continuing to do the next 5. They've been doing that in waves. So we have slowly seen, a variety of patients and staff members that have been loaded up into these ambulances heading to Sumner Regional Medical Center. We don't know yet what the total number of patients are in this round, but as you mentioned, Emily, this already comes after 41 patients have already been transferred in a outbreak that just continues to grow. So far, 41 patients have been whisked away from the nursing home, either testing positive or showing symptoms of COVID-19. Saturday, with the help of the Tennessee National Guard dressed in hazmat suits, all staff and residents were given a COVID-19 test. Slowly, those results are starting to come in.
We are anticipating positive results of those patients, and they will be sent to local hospitals.
For the first time since this all began, Dawn Cochran, administrator for the Gallatin Center, spoke to reporters.
And I had a very much important position to take care of patients instead of talking to the media. But I want to share our side of the story.
She couldn't tell us how many residents or patients tested positive in Saturday's rounds of tests, but believes they have done all they could to limit the spread.
We took it very seriously because we knew how serious this virus was.
I asked Cochran, is there a scenario where they would shut down this facility altogether? I got an emphatic no.
We are fully prepared to keep the patients that test negative and all of our employees that test negative, and we have a full staff that will be coming in to relieve those that will have to leave.
But in order to do so, she will need her team to continue to work long hours, a challenge she claims they can handle.
Our employees care so much about our patients. We are committed to them.
So now I want to give you a lay of the land of how this triage center is working. This is the emergency operations center where all of the command is basically located. They are going to bring in ambulances through this parking lot and bring them around. In fact, you can see one coming by around this way. This is actually the first Nazarene church here in Gallatin. They're lining up all these ambulances kind of in a row to get ready to go across the street to load up these patients. In the foreground here, you can see the Tennessee National Guard. They are also here to assist with individuals loading up these people one by one. So basically, we have not been given a clear number from the mayor or from the administrator on how many people have tested positive for COVID-19 today and how many more transfers there will be. So we're going to continue to count ambulances. That's really the only way we know how to keep up with this count. It's 41 before. We already have our first 10 today, so it's currently up to 51, and we'll continue to count how many people are actually loaded up so we can keep you updated on this situation. Emily?
All right, Chris, thank you.